Back to this discussion on your health on Morning Express, and today we are talking about disease outbreaks and our preparedness. And just before the break, Dr. Emmanuel Okunga, the Assistant Director of Medical Services from the Ministry of Health, was just illustrating the network of experts that across the country that respond to disease outbreaks. And Lydia here and Peterson, who are volunteers to West Africa, were did not quite agree with Dr. because they say we still have outbreaks in the country. So I want to pick it up with Lydia. If we have this whole network and 5,000 trained experts in disease surveillance and on outbreaks, why is it then that we still have outbreaks? What did you do differently when you're in Liberia that we should probably adopt?
The 5,000 people are too much resource already in Kenya. And I'm thinking from my own perspective that we should not be having outbreaks at the moment. This should be controlled from preventive measures that should be implemented in the community. Just like the government is implementing the community strategy, which is still rolling out in various sub-county divisions. And in my own feeling, we already have a resource. We already have people who are well-trained. Then they should do their work. Either it is the people who are not doing the work, or it is a system that is not working. And at the country at the moment, just like I echo the words of Peterson, we should not be having those outbreaks, Daktari.
So what did you do differently in Liberia?
What we did differently was consistency. The practice was consistent. Everyone was aware what you should do. If it is infection prevention, we already know the cause, the transmitting agent, the prevention that you should do. So you're trying to break the disease transmission cycle at every stage so that the disease does not progress continuously and it does not infect people. So this should be something that should be consistent. It should be training. There should be training in and out. It shouldn't be something that comes in once and then we see it again after another outbreak. It should be consistent. I think this is where we should pick it up from. Get consistency, get proper training, continuous assessment, measure our skills. Are we up to par with what is expected as per the diseases that are occurring? With the change of climate, with this climate, with the change of with other infections coming in, is our surveillance up to standard? Are we able to investigate further to know are there other diseases that could come up about? Just like Ebola, nobody knew that Ebola could strike in West Africa, but it struck when nobody was aware. So I think that's where we should be. We should be more vigilant.
Okay, Dr. Ria is saying obviously the departments are there, they're in place, they are vigilant, but she's saying we shouldn't have disease outbreaks. We have disease outbreaks. We report almost every other day. Why is it still the case if we have the right expertise?
You know, we cannot entirely eliminate emergence of disease outbreaks. We will always attempt to prevent disease outbreaks. If, say, you said malaria, you'll do bed nets, you'll do environmental management. But sometimes you have disease outbreaks because of factors beyond what you could do. So the current cholera outbreaks have largely been associated with the drought. So you see, that is something that we probably will not prevent. However, there are other measures that we have in place. Like, for example, for detection, we have the National Public Health Laboratories, and which is a network across the country. We also have KEMRI that helps in confirmation of most of these diseases. So we cannot say that the country does not have diagnostic capacity. That is largely there. So for prevention, this is where we are saying the country is implementing community strategy, because when we empower communities to take control of their health, then we'll prevent most of these things. For example, cholera. Basically, it's about safe water and safe disposal of human waste. So those are things that are about community engagement, and that is why the government is also rolling out a program called Community Total Sanitation, led by the Division of Environmental Health. And while we have not yet covered the whole country, but there are a number of counties that are already under that program.
Okay. Peterson, I want to just engage you. Dr. is saying we have the capacity. So where are we getting it wrong?
I think, first of all, the notion that we have adequate resources is misleading. We are talking about 5,000 for a country of 45 million people. That cannot be adequate. And I think Dr. has to agree with us that we have a shortage. And I want to also add to what Lydia said, that the baseline, when you want to eradicate an outbreak or to prevent, is community mobilization, which must be robust. And this is what made the difference in West Africa vis-a-vis in Kenya, as we have seen with cholera outbreaks. Because the preventive bit has to be owned by the community. You have to go down to the community to know how do they behave day to day. Like when it comes to Ebola, you realize the reason as to why it is spread so fast is because of their behaviors and their traditions and customs. Like in Sierra Leone where I was, when one gets sick, everybody in the village will be coming to your place and then they are going to lay their hand on your face. And you can imagine Ebola, you transmit it by even the excretions and the sweat. And so that is how it is spread. And then when you die, they usually bathe you somewhere in a room. They remove all your clothes and bathe you before they can be able to dispose the body. And their customs could not allow for the disposal using the polythene bags, the way we were doing. And so it took a lot. And you know, also it had some political element. That this is the government that has decided to use Ebola to eradicate some people who are believed to be opposition. And so you had to go down to the community, grasp this, and then you can be able to come up with a strategy that first is going to change that notion. Because they believed that when they came to the facility, the medics had been instructed to inject them with poison, so they are going to die because they believed it was political. So, and that is why the foreigners, because there we were considered foreigners, we were able to get some headway in this because we were able to convince them that we have nothing to do with your politics. We are just here for your well-being. So you have to understand the community, then you mobilize the community so that they can be able to change their behaviors. But that is not happening in Kenya. From my own village, because this we can be able to see, and that's why I'm saying it's not adequate. I've not seen even at the division level or a sub-county level where I can see some people. I remember in the past when I was in primary school, we used to see some health workers, I think they were public health officers, coming to school, giving health education, coming to community barazas. That is, it's a thing of the past. I've not seen it.
Lydia, do you have something of a contrary opinion, seeing what we are doing as a country from what you used to do previously, as it says, from what you did in Liberia and what we are doing currently?
Oh, just like he says, that community intervention, yes, it's there in books and in writing, but the community is totally not aware of probably what it should be able to do to prevent these diseases. Even if it's aware, it's a small percentage. Because if you're looking at a population of 39% adults or above youth, these are people who can be able to process information. And if we look at children, when he was in primary school, he said they used to see public health workers. If you are a child and you're given the right information, health information, then this will definitely stick in your head and you'll adapt those behaviors, unlike what is happening today. Because what is happening today is just like he had said earlier, probably there is not enough resource. There's not enough resource to process the community strategy, and this resource is supposed to be coming from the government. And part of this is expertise, the expertise that you already have, the medication that you already have. And this medicine, if it's not taken well, then it will not be able to heal.
Daktari, they have raised a few issues about community awareness and what the government's role should be. And so I would like to ask, as a way forward or moving forward, what is it that the public should know, and what is it that the government is doing to make the public aware about these things?
First, I think we need to bring to attention of the public that structures exist that can support them in disease control. And besides the surveillance officers we are talking about, we also have public health officers in every county, at sub-county level, all the way down. We also have community health volunteers, as we had said, who are the major conduits for public health education in the community.
Where does the public get these people? How do they get in touch with these people?
You know, the community health volunteers are actually elected by communities. So they live within the communities, and they report to the health system. So those are people that already exist within communities. Communities know them. Two, in terms of contacting the health system, we have an emergency operations center, and we have the numbers which you could share with the public.
Yes, I'll actually share these numbers in a few. Just to continue.
So those, if anybody wants to contact the health system because seen an unusual event, not just diseases, but even other public events like fires, like road accidents, you report, you just call those dedicated numbers, and you'll get assistance.
Let me just read out the Emergency Operations Center numbers. This is at the Division of Disease Surveillance and Epidemic Response, and the two numbers are 0732 353535 and 0729 471414. These are the Emergency Operations Center numbers in case of an emergency, in case of a disease outbreak, in case of a fire, as Dr. says, or in case of a road accident. The numbers are 0732 353535 and 0729 471414. Through these numbers, you'll be able to get in touch with the Emergency Response Center, Emergency Operations Center, and they'll be able to respond to your emergency. And this is based at the Ministry of Health, the Division of Disease Surveillance and Epidemic Response. So, so thank you, Dr. for the numbers. And Lydia, as a way forward, what should the public be aware of? Having been, well, as you being one of the experts that has responded to one of the worst outbreaks, what do you think the public should really be keen and aware of?
All right. I would say that first and foremost, we have public-private partnership. There are other organizations that are dealing with this. If the government is not fully sufficient, I'm sure there is that avenue. So the public should be aware in case, just like you have said, in case of any emergency, in case of any outbreak, they should know where to contact. And this, I'm sure the government is in conjunction with other organizations that are well and like-minded in this fight of diseases. And also, it is good to uphold all information that are directed and channeled in terms of prevention, in terms of curative diseases, in terms of any information that is that determines the health of the human being. May it be just washing hands, just cleaning your hands with soap and water, decontaminating your surfaces. The community also entails people who are working in hospitals. I would give an experience of Ebola. We were seen like people, if you're a health expert, many health experts died while giving service. As a health expert, it is always good to follow protocol. There are outlaid protocol and policies by the government and other organizations that have outlined their protocol in line with the government protocol and policies in terms of disease prevention, infection prevention. It is always good as a health provider to always follow that protocol because most people died because of lack and breaking the protocol.
Okay,
yeah.
Thank you very much. Peterson, from your opinion, what should the public be aware of moving forward?
I think the public is supposed to be informed about the preventative measures that are there, depending on the conditions that we are dealing with. In Kenya, mainly, we have had several outbreaks, the fecal oral, like the cholera, where basically you want to talk to them about the basic hygiene, from safe water, hygiene like washing hands, as she has said. We also need to look at dengue, chikungunya.
Which are mainly mosquito-borne. Like
yeah, which are mosquito-borne, and then you want to look at fumigation, you want to look at clearing bushes and such. But then, this has to be consistent. This information has to be the community at all times. It can't be something that you want to do periodically, because if you do it periodically, then the periodicity will be in the curative of the outbreaks and not the preventive. And I think borrowing from what I've heard from Daktari, even from the community level, I think the way the strategy is, the procedure of the strategy is in such that you'll only get the cases that are already there. But I would like to hear more of how are we preventing so that we are not supposed to have a case of cholera in Kenya. We are beyond that. Yeah.
Okay. Thank you, ladies and gentlemen, for your time this morning. Maybe just in conclusion, just briefly, in a sentence or two, your parting shot on this topic.
Basically, what we need to, and we'll agree with what Peterson is saying, we need communities to be engaged, to have control over their health issues. Of course, resources are never enough. They're never adequate, but we must work within the resources that exist, partnerships. We work with many partners, the WHO, UNICEF, CDC, and many other organizations, and different countries. So I think my parting shot would be, let Kenyans not be desperate about the scenarios around. There is work going on, and while we agree that more can be done, but already there is good work going on. Okay,
thank you. Lydia, in a sentence or two, your parting shot?
I would like to say that I am an expert, and I am utilized well wherever I am. But I know there are out there many people with a lot of expertise, with a lot of skills and knowledge, but they are underutilized wherever they are.
Okay.
So, Daktari, please pick it up and let them shine.
I'm sure he has taken notes and will definitely do something about it. Peterson, your parting shot in a sentence or two?
Yeah, thank you, Mercy. And mine will be about, as I said, priority. And to start with, I want to say that Ebola volunteers are not happy. And they are not happy because the ministry has treated them with indifference. Before we came, about 2 weeks before, we did a letter to the president himself, and we requested that this expertise be preserved in the national government, because we know the national government has a legal mandate to capacity build counties, because you cannot have experts in every county. And the president pronounced himself that these people should be employed so that we can reserve this expertise. This has not happened 3 years down the line, 2 years and counting. And what we are saying, it's very bad for a country like this to treat heroes, because we are treated as heroes, and that is why you can see us wearing medals.
Yeah.
But then our expertise is going down the drain. We have several volunteers that I know that right now are frustrated because they do not have gainful employment. Yet we have a ministry that talks of shortage of human resources, but only about 95 of them who are not employed, they cannot be able to employ. And so we believe that there was a desperate, not desperate, but a deliberate decision to not employ these people. And this is something I would like to understand why.
I think, well, luckily Daktari is here. We'll pick this conversation after this, but I'm sure Daktari has taken note and we'll be able to discuss that particular issue after this because, well, we know the country needs all this expertise, especially now that we have sporadic incidences of disease outbreaks. So we'll pick this discussion and we'll continue with it after this. But I'd like to thank you very much for your time this morning. We've been discussing on your health, on disease outbreaks and the response by the government, by our experts, and we've known today by Dr. Emmanuel Okunga, who is the Assistant Director of Medical Services. He's also a medical epidemiologist, that we have an emergency operations centers under the Division of Disease Surveillance and Epidemic Response, and their numbers are 0732353535 or 0729471414 in case of an emergency, in case of a disease outbreak that you suspect. These are the numbers to call to get in touch with the relevant authorities so that they can respond. And we know that there's a network of about 5,000 experts that are trained in emergency response. We had Lydia Kamau, who is a nursing officer and was a volunteer at the African Union support to Ebola in West Africa, and Peterson Washiro is a clinical officer, was also a volunteer and a team leader to the Sierra Leone African Union support to Ebola in West Africa. And that's where we wind up this morning's edition of Your Health. Stay tuned next Wednesday for another session of Your Health with me, Dr. Mercy Korir. And that's where we wind up today. Michael, what's next?
Well, thank you very much, Dr. Mercy, and that information definitely going a long way, and evidently there is much more that needs to be discussed in those areas, and we shall entrust you with that responsibility. For us now, time is up, and Morning Express comes to an end right about now. But do stay with us right here on KTN News.